Most men never find out until it's too late. Not because the warning signs weren't there, because nobody told them what to look for. I'm going to tell you now. My name is Dr. Marcus Elaine. I'm a urologist and men's sexual health specialist. I've been practicing for over 22 years, most of that in a clinical setting where men come to me after years of silence, years of embarrassment, years of doing the exact things I'm about to warn you against. The reason I started making these videos isn't complicated. It's a patient, a man named Daniel, 43 years old, high school football coach, hadn't been to a doctor in 11 years. He sat across from me in my office and told me he thought everything he was experiencing was just getting older. He'd been told that by two different people in his life. He believed them. By the time he came to see me, we were already in damage control territory. Nerve damage, restricted blood flow, performance that had collapsed quietly over about 4 years while he kept telling himself it would pass. It didn't pass. Pause. Daniel's story is not rare. What happened to him, what nearly every man in that chair has in common, is that they ignored things they were taught to ignore. They were trained from the time they were young to push through, to not complain, to treat their body like a machine that would just keep running. The body doesn't work that way. And the penis, specifically, is one of the most sensitive early warning systems in the entire male body. When something is going wrong, cardiovascular, neurological, hormonal, the penis often signals it first, long before a heart event, long before a diagnosis. The signal is there, quiet and early if you know what you're listening for. So let's talk about what you should never do. And I mean never. The first one is something almost every man does without thinking, ignoring changes in morning erections. Most men think morning erections are about arousal. They're not. They are a physiological check, your body running a diagnostic on vascular and nerve function while you sleep. During REM sleep, the brain sends a signal to increase blood flow to the penis. This happens 3 to 5 times a night. What you notice in the morning is just the last cycle before you wake up. Pause. When those morning erections start becoming less frequent or less firm, that's not aging. That's a data point. A study published in the Journal of Sexual Medicine found that changes in nocturnal and morning erections are among the earliest measurable indicators of endothelial dysfunction, which is medical language for the inner lining of your blood vessels starting to lose function. This is the same mechanism that precedes cardiovascular disease. I explain it to patients this way. Think of your arteries like garden hoses. Healthy hoses are flexible. They expand when water pressure increases. They deliver full flow. When those hoses start to stiffen, when the walls lose elasticity, you notice it at the tap first, not the main line. Morning erections are your tap. They show you what's happening in the infrastructure before anything else does. The practical action here is simple. Pay attention. Start noticing. If you've gone weeks without a strong morning erection and you're under 50, that's worth a conversation with your doctor. Not an emergency, but not nothing either. Don't dismiss this one. I've seen men wish they hadn't. Now here's where things start to get more specific. A lot of men know that something feels off with sensitivity, but they assume it's psychological. Stress, distraction, they're tired. And sometimes that's true, but there is a physical version of this that has nothing to do with your mind, and most men spend years not recognizing it. Reduced penile sensitivity is often neurological. The nerves that supply the penis, particularly the dorsal nerve, are some of the longest peripheral nerves in the body. And peripheral nerves are vulnerable. They're vulnerable to compression, to glucose damage from prediabetes or undiagnosed diabetes, to deficiencies in B12 and folate, to chronic inflammation. What this feels like isn't dramatic. It doesn't announce itself. It's more like the difference between touching something with your bare hand versus touching it with a latex glove. The sensation is there, but it's muffled, slightly removed. You might only notice it during intimacy, a kind of distance where there used to be immediacy. At night, when everything else is quiet, some men feel it differently, a faint tingling or numbness that's easy to explain away. Don't pause. The NIH estimates that approximately 30 million American men are affected by some form of peripheral neuropathy. The penis is not immune to this. In fact, for men with prediabetes, a condition affecting 96 million Americans, most of whom don't know they have it, Reduced penile sensitivity is sometimes the first symptom to appear, years before a formal diagnosis. Think of the nerve like a fiber optic cable. Full signal, everything is crisp, fast, complete. When the cable is damaged, even slightly, data still moves, but something is missing. You can use it, but it's not what it was. Here's what I want you to do. If you've noticed a consistent change in sensation, not occasional, not stress-related, but persistent, get your fasting glucose checked, a simple blood test. That information could change the trajectory of the next decade of your health. If this sounds familiar, I genuinely want to know. Type something in the comments, even just yes, because what I'm hearing from men watching these videos tells me how many people this is actually affecting, and the number is much higher than any study captures. But here's what makes this even more concerning. Most men who ignore the first two signs arrive at the third one without realizing they've been traveling a road. We're talking about erectile dysfunction, not as a punchline, not as a commercial, but as what it actually is, a vascular event warning signal. The New England Journal of Medicine published findings that men with ED but no cardiac symptoms had a significantly elevated risk of cardiovascular events within 5 years. The mechanism is the same: arterial narrowing, reduced blood flow, endothelial damage. The penile arteries are smaller than coronary arteries. They show the damage first. This is why I tell patients, ED is not a sexual problem. It is a cardiovascular signal wearing a sexual costume. When Daniel, the football coach I told you about at the start, first noticed that things weren't working the way they used to, he was 38. He told his wife it was work stress. He told himself it would get better after summer. It didn't. By 43, when he finally came to see me, his endothelial function markers were those of a man 15 years older. His cardiologist, who he'd never met before, told him he had probably had the vascular signs of early coronary disease for 3 to 4 years before he arrived in my office. The erectile dysfunction was the flare. The actual fire was in his heart. Let that sit for a moment. The Mayo Clinic is explicit about this. ED occurring before age 50 should be treated as a potential early marker of cardiovascular risk and investigated accordingly. Not medicated and dismissed. Investigated. I always frame it for patients this way. If the engine warning light came on in your car, you wouldn't put tape over it and keep driving. You'd ask what it's connected to. Erectile dysfunction is the engine light. The tape is a blue pill that treats the symptom without ever asking the question. That doesn't mean medication is wrong. It means it should never be the only answer. This next one, I almost never see it in anything written for the general public, and I think that's a mistake. Peyronie's disease, penile curvature caused by fibrous scar tissue. The common assumption is that it's cosmetic, that it only matters aesthetically or during intercourse. Most men don't know that it can be profoundly painful, that it can develop rapidly, and that ignoring it while it's still in the inflammatory phase, the first 12 months, is the single biggest mistake a man with this condition can make. Peyronie's affects roughly 1 in 11 men. That's a significant number, and the vast majority suffer in silence because the conversation doesn't exist in mainstream men's health. Here's what's actually happening. After trauma, sometimes dramatic, often minor, sometimes men don't even remember a specific incident, collagen deposits form in the tunica albuginea, the fibrous sheath that surrounds the erectile tissue. These deposits don't behave like normal tissue. They don't expand the way healthy tissue does during an erection. So as the rest of the penis expands, the plaque stays rigid. The curve forms at the site of the restriction. Think of it like having a rubber band wrapped around one side of an inflating balloon. The balloon grows on one side. The other side stays where it is. The result is a pull, a bend, that worsens with each erection if the plaque is still forming. The pain, and for many men in the acute phase, there is real, significant pain, tends to be worst at night. You're lying still, nothing to distract you, and an involuntary erection becomes a source of genuine pain instead of anything else. Men don't tell their partners. They don't tell their doctors. They wait. And waiting, in this case, costs them. A research review in urology confirmed that early intervention, particularly in the first 6 to 12 months, significantly improves outcomes. Once the scar tissue calcifies, the window narrows substantially. Do not wait this one out. And now we arrive at the part of this conversation that I carry with me most heavily. because what I'm about to describe is the end of the road for men who ignored everything that came before it. Penile cancer is rare, but it is real, and the behaviors that increase risk are so normalized in men's health culture that most men never connect the dots until they're sitting in a chair like the one in my office. HPV, human papillomavirus, is the primary driver. The CDC has confirmed that certain strains of HPV are responsible for the majority of penile cancer cases. HPV is extraordinarily common. What is not common is the knowledge that it can remain dormant for years, and that the visible changes it sometimes causes, small lesions, discoloration, areas of thickened skin that don't go away, are almost universally ignored or explained away by men who are not in the habit of examining themselves. Here is what I need you to hear. A change on the skin of the penis that does not resolve in 2 to 3 weeks needs to be seen. Not Googled, not watched, seen. The 5-year survival rate for penile cancer caught at stage 1 is over 90%. By stage 3, it drops below 50%. The difference between those numbers is often just time. Time that men spent waiting, hoping, assuming. I had a patient, 61 years old, retired electrician, sharp as anyone I've ever met, who came in with a lesion he'd been watching for 8 months. 8 months. When I asked him why he waited, he said he thought it would sort itself out. He's alive. He kept the organ. But the surgery, the recovery, the fear his wife carried for a year, none of that had to happen at the scale it did. This is where the emotional weight of this conversation lives, not in the statistics. In the fact that the men most likely to be in that chair are the ones who were never told they were allowed to pay attention. So here is what I want you to leave this video with. Not panic, not a list of fears, a habit. Once a month, look. That's it. Once a month, examine yourself the same way you'd notice a mole on your arm that changed color. You already do this without thinking in other contexts. Do it here. If you've noticed any of the signs we talked about, declining morning erections, reduced sensitivity, erectile changes, curvature, or anything on the skin that won't resolve, make the appointment. Today, not next month, today. And if this video gave you something you needed, tag someone who needs to see it. Not because I'm asking you to share a video, because you might be giving someone information they didn't know they were missing, the same way someone should have given it to Daniel before he was 43. You now know what he didn't. That matters. Don't let it sit unused.